Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. Now, I wanted to chat about a couple of things today. First, exciting news. I've been hinting at this for a while now, but it is time now to let me know if you would be interested in participating in treatment trials for, drumroll, our horrible gastroparesis, constipation, and delayed gastric emptying. Yay! Now, I will not be performing the trial. A medical group that is independent from my company will be performing the double-blind trial, but I've offered to help get word out in order to bring in the participants. As is dictated by science, we'll have two groups. We'll have a treatment group and a placebo group. But fear not, the placebo group will switch over to the treatment group in a couple of days. I will help qualify the patients and will need to be sure that you don't have bowel obstructions, etc., causing your problems. But in order to get a patent for this medication, a mini trial was conducted and patients responded within 2 to 12 hours without fail. Yay! It was designed to work around a vast array of potential genetic defects and even autoimmune involvement. I also had to be sure that a feedback loop was not involved, meaning that your body would need more and more of the medication over time, and then one day it might not work at all. So I gave it a year to be very certain about this and only noticed a slight decline in the need for it. Yay! Now, this medication will hit a lot of other symptoms too, but because the gastroparesis constipation relief is so immediate and objective, it's a great place to start. So I'll be gathering interested folks for the next 2 months or so and qualifying you as soon as I can get to you. So heads up, after much debate, we decided to run this trial out of Texas. Yay! So you would need to be able to be in the Dallas-Fort Worth area for about 2 to 5 days. There's no charge for the medication or to participate, but since it's currently self-funded, that may change. There is no reimbursement for travel or participation at this point. We'll reach out to a few organizations to see if assistance can be provided. However, okay, I'll let you know. Meanwhile, you can email us at clinical_trials@prettyill.com. I'll contact you as soon as possible. Bear with me, okay? Lots going on over here. Now, I should mention that this medication is a combination of over-the-counter natural supplements. Generally, these do not go through clinical trials, but it is important to me that this is not pigeonholed as another out of the fringe, possibly snake oil treatment. Sound good? I cannot tell you what a relief it has been for my kids and I to never have to think about our bathroom habits anymore. I threw away 4 of those big Tupperware containers of every GI medication known to man. I was hospitalized twice with severe gastroparesis, and I had a fear of bowel rupture. Not to mention I looked 9 months pregnant half the time. Yeesh. I can't tell you how great it is to not even think about it. It's amazing that normal people also don't think about this. If you're like me, my mood on any particular day was often dependent on whether or not my time in the bathroom was successful. That's pretty pitiful. Now, I look forward to hearing from you, and please feel free to share this on Facebook, Twitter, other forums, etc. Cool? I can hardly wait. Now, I wanted to share some thoughts from some patients for you. It's always encouraging to hear from folks who are grateful for help and enlightening to hear from others who are not. I love this one from Michelle. She writes, "Dear Dr. Diana, I am 53 years old, and today for the very first time I cried about my EDS. It was when you were speaking about hypermobility EDS. You are the first person ever who told me what my body was doing. I'm so sorry you are ill, but it was wonderful hearing that someone believed me, someone understood, someone really cared. I was in my 20s before anybody listened. In my 30s, I was told to get a hobby, and it was all in my mind." Sound familiar? "My parents seemed annoyed with me, asked me not to attend my grandma's funeral if I was going to limp and show them up. A broken marriage because I couldn't have children. In all that time, no one came forward to hug me. You did today. Yes, you're on a PC, but you reached your hand out, and that made me cry. I am in England, but if I can ever help you, please let me know. Kindest regards, Michelle." Oh, man. Yeah, I'm a hug person, and some people think it's really weird, and I've been giving them kind of a hard time of it. But I don't think spoonies get enough hugs. Be they virtual or real, we need more of them. So, cool. Okay. Let's see, there is another one. Oh, this is so cool. This is from Allie B. She wrote me the sweetest poem. She calls it Dr. Diana, and she writes, "You are the brightest star by far in the medical galaxy of our pretty ill reality. You bring hope and optimism for our compromised vitality. With a tenacity like Tigger when it comes to research vigor, you're a detective so effective on the trail of our lost figure. Your passion and compassion surely shows you have been there. It's not driven by an ego, no, it's driven by your care. Sincere and spoonalicious, you really comprehend. I feel I'm pretty honored you considered me your friend. The ocean may be big, but I know just where you are. In the darkness of our night, you're the brightest star by far." How great is that? Okay. Then there's this one from another forum. Okay. I can start by saying that having read some of Dr. Driscoll's theories, that she is a patient, not a researcher. Gosh, okay, ouch. Well, I am a patient, but I have run 3 clinical trials listed in clinicaltrials.gov and have conducted 2 in-house preclinical trials. All but one of these were self-funded, and they were not cheap, let me tell you. So, ouch, again. Okay, this one is important. And I seem to need to revisit this fairly regularly, but we'll do that. Let's see. This person says, she is discussing CCSVI. I understand this is very dangerous, and there have been deaths from CCSVI. I noticed that she removed most of her information about CCSVI. What gives? Okay, let's be surgically precise here. Excellent points. CCSVI, or chronic cerebrospinal venous insufficiency, is a condition of the veins in the neck and the azygos veins. Okay, the condition exists, although with so much drama involved, I don't even like to use that term anymore. What this person is likely referring to is the proposed treatment for CCSVI. That would be angioplasty or dilation of the veins. My son and I did undergo treatment with angioplasty, but I had no real response. My son actually experienced a day of increased tachycardia, but no improvements. Now, I've reached out to others who've had this for POTS or dysautonomia, and everyone that I'm aware of either had no improvement or the improvement that occurred was short-lived. Now, I was watching one young woman closely who did seem to be doing so much better, and I was trying to keep an open mind. But I understand now that she too has returned to baseline. Now, I did develop a thrombosis at the site of the angioplasty. Yikes. But that's not uncommon. Now, I was put on heparin, but then I developed osteoporosis. Now, I can't say that it was because of the heparin, but I know that we are more prone to osteoporosis. Heparin can encourage osteoporosis, and our hematologists really need to be aware of that when thinning our blood. So yes, I did take down most everything about CCSVI. People have had trouble separating CCSVI from angioplasty, and I think it's critical to do that. So I strongly believe we do have a systemic disorder of our vessels, and we require systemic treatment. I also believe that more of our problems stem from the abnormally enlarged veins, not the narrowed ones. And angioplasty won't make the veins smaller, right? So research continues. Now, I'd like to close with this beautiful poem sent to me by Allison Brewer. Allison, will you be sure to enter our Spoonie Art Contest? Writing is an art, right? I think many of us can relate to this. And although you see me on the videos looking semi-normal, believe me, I have seen more of my bed and the 4 walls around it than I had ever planned to. And here is a poem that Allison wrote called How Many Hours in 24? I love this. Okay. How many hours in 24? I'm rushing, I'm dashing, I wish there were more. I have work, I have leisure, and pleasures galore. So much to squeeze into this life I adore. Birthday celebrations are a family affair, a nightmare to organize to get everyone there. How many hours in 24? So little time, so much in store. All the sudden life grinds to a halt. My whole body damaged by a viral assault. How many hours in 24? My life has been taken, I'm sick to the core. In my room I'm entombed, the air it hangs stale, immobile, imprisoned, stuck here in jail. How many hours in 24? Minutes become hours, it's not like before. My curtains are closed when I can't bear the light, nothing to look at, no view in sight. How many hours in 24? When your view is the ceiling, the walls, and the floor. Others are busy with lives of their own, hour upon hour, I spend all alone. How many hours in 24 as life carries on, but outside my door? Infinite nights haunted with pain, a daunting reality visits my brain. How many hours in 24 when you cannot shut out the perpetual snore? Each day is a battle, a fight to stay well. Not enough soldiers. It's as scary as hell. How many hours in 24? I fear time's running out and I'm losing the war. Allison, hang in, okay? I have dedicated my life to getting answers for us all. Don't ever lose hope. So until next time, let's continue to change our worlds, one brain cell at a time if we have to. Gentle hugs to you all.